Hello, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to go through some exercises if you wake up with a stiff neck. We've all been there where we've fallen asleep on an unusual surface or even just gone to bed and woken up with a neck that's a little bit painful. This painful neck can lead to difficulty with moving during the day, difficulty performing our job, headaches. It can even lead to more problems along the line if it's not fixed correctly. There are a few things you can do right off the bat when you feel that you have a kink in your neck to help alleviate that pressure. If you, at all during these exercises, feel numbness and tingling going down your arm, feel any sort of sharp increase in pain, you need to stop and consult your healthcare practitioner immediately. The first thing you can do upon rising and realizing you have a stiff neck or a kink in your neck is just start gentle range of motion. You want to start by just doing nice and gentle circles. You may only be able to do very, very, very tiny circles. That's okay. Do them in a pain-free range. Each time you do a circle, try and get a little bit more range out of it. If you can't, that's okay. Just keep moving in that range that you're able to move without having it be excruciating. This is going to get the blood flowing to the muscles and start loosening up the muscles that are tight. The next thing you want to do is start to rotate your head side to side. Again, this is in a pain-free range, so even if you can only move a few degrees side to side, that's okay. Nice and slow, nice and easy. It also may help to be underneath a hot shower when you're doing this to help the blood flow increase to the muscles also. And then finally, you just want to nod your head nice and slow and gentle. Again, in a pain-free range, just going up and down as far as you can. Try and get a little bit further and further each time. The next thing you want to do is an upper trap stretch. So you're going to gently tilt your head to one side. If that's a stretch for you, then that's where you stop. If you don't feel the stretch, you can then put your hand on top of your head and pull it, stretching out that muscle a little bit further. You should not feel pain with this, so if you feel pain, take your hand off your head and just lean it to the one side and hold it. You want to do this on both sides. You want to hold this for about 30 seconds, and you want to do about 6 on each side. Again, this should not cause any numbness or tingling, any sharp increases in pain. If you're experiencing anything like that, you want to seek other medical care. The last thing you want to do is a self-massage technique. We use a BC ball here in the clinic because we find the spikes get in there a little bit better and break up some of the garbage that's in the muscles. You can use a tennis ball, a lacrosse ball, anything that'll really kind of get in there and break up that muscle. You want to go ahead and put this along the wall. You don't want to try and grab your neck. Grabbing your neck and trying to do this type of self-massage only puts more pressure on your neck and more strain on the muscles that are already sore. So just find a wall, put the ball up against the wall, and nice and easy, up and down. Just do this as long as you have time for. You don't want to do this real aggressively because you're most likely in pain and it's not going to feel great. But this will help break up some of the knots that are in there. As you break them up and as you feel a little bit better, you may move this technique to the floor and continue massaging and getting in there. You want to get in up around the neck, around the shoulder blades, because the muscles from your neck go down and go all the way down your back. Those should help alleviate some of the neck pain if you wake up and you have a stiff neck.